the biggest part here to really note is both of our kidneys. And remember, this is all sitting retroperitoneal. That peritoneum is that sac of guts, so to speak, that we just took out. And then this would be sitting right up underneath of it. Does that make sense? Mm-hmm. So retroperitoneal makes you also understand that if someone has a kidney stone or kidney infection, where would they complain of pain? Lower back or about T12, L3, L2 region. You could also see a difference between how the kidney sits on the right side versus the left side, and you tell me why that is. Because we have a large liver that kind of pushes that kidney down a little bit. So cool. And what is this tissue on top of it, which is another gland? The adrenal glands. Excellent. I have done a coronal cut on this kidney, so I'm going to show you that in a bit on what's happening on the inside. And you will see here, we've already done these. This is your inferior vena cava, and this is your abdominal aorta. Good, got it. Now, we clearly see some things hanging off of both kidneys, and they come to this little structure down here. What are those? Ureters, T-E-R, and it collects in an organ called the urinary bladder. Now, this urinary bladder, you can see that the ureters wrap around and pierce inferior. Why does it do that? I'll tell you why. So on the inside of this is rugae as well. So if we were to open up the urinary bladder, it will look very similar to the foldings in the stomach. So we know it's a vesicle that can expand, right? So every time you see rugae, it's probably in an organ that is made to kind of blow up. And we all know your bladder can blow up, right? And if we were to just drop from the ureter to the urinary bladder up top, it would have to travel down. Like you could hear or probably feel plop, plop, plop of fluid going down into the bladder. So instead of piercing it up top or superior, we pierce it inferior and we fill from the bottom to the top. Does that make sense? Isn't that neat? I always thought that was really cool. And so you could see that the urinary bladder is nothing but a muscle. There's really not much to it except for that rugae. And you could see that this is a male. How do I know that? Because this is the prostate gland hanging off of it. And now you know that if their prostate is enlarged, what is the number one symptom of that? Frequent urination. Because what is it putting pressure directly on? Your bladder. So this is a walnut-shaped looking structure. So now that I've made a coronal cut on this kidney, I want to show you what's on the inside. The outside, everything exterior, is known as the cortex. And the inside is the medulla. Okay, so the inside is the medulla. Those seashell-looking structures are known as the renal pyramids. And they really do look like seashells. This model shows one intact and the rest of them are cut up. And they all drain into certain collections. And so the renal papilla, or the pyramids, which is the region what they're in, drain into minor calyces, and a couple minor calyces come together to make up a major calyx, and the major calyx makes up the opening of the kidney, which is for the exit of that fluid, called the renal pelvis. The renal pelvis then becomes the ureter. Now, what is our exit from the urinary bladder? Is the urethra. We have one urethra and two ureters.